Welcome back to Technique Tuesday. My name is Dr. Nick Hunter, physical therapist here at Preferred Physical Therapy, and today we're going to talk about hip bursitis. I'm going to show you 2 exercises you can do to help relieve it, and we're going to discuss what it is. Hip bursitis is commonly a diagnosis given to patients who have pain on the outside of their hips. I get a lot of folks who come in and say they have this pain kind of over where their pocket is, sometimes even migrating down into the thigh or the leg. I've had some patients say they have pain just in putting on clothes as it rubs across the skin on the outside of their leg. I've also had one say that when they were sitting down in church and they had a young one come and sit next to them, just hitting them or contacting on the outside of the leg was very painful. Commonly it's right across the hip bone. And a bursa is a fluid-filled sac. It's very kind of thin or not really inflated, but it's a pocket of where there's a little bit of fluid that allows for movement or friction to be reduced around an area where there's movement. Joints are very commonly where they're located. And so what can happen is they can get irritated, pinched, or fluid-filled or swollen, and that all causes pain. So what we're trying to identify is why is it irritated? Why is it suddenly a problem when commonly it's not because of trauma or irritation from a fall or an incident, but it's slowly over time. And what's causing that? We see a high correlation with this glute med weakness. So we get this high hip musculature that becomes weak or problematic, and now it's not involved as much in stabilizing or supporting the hips and core. And then very commonly it's a referred pain pattern that goes down the leg. Easy way to say, okay, do I have this kind of issue? Put your hands down at your side, identify kind of that spot on the outside of your leg, and then relax and then push into it a bit. How tender is it? And compare both sides. Is it quite tender? Is one side more or worse than the other? It's a very common spot for this referred pain pattern that goes down the outside of the leg. 2 things I like to do with it is to lengthen or stretch glute med and IT band. So one thing that we'll have you do, what you're going to need for this is a dog leash, beach towel, belt, bed sheet, whatever you need it to be. Put your foot into it, lay on back, and this is my painful side. I'm just going to stretch easy by keeping that knee straight, my toes pointing kind of inward and up, and I'm going to pull across this side. As I do, you should feel a little bit of a stretch coming around the outside of the leg, kind of from the glute on down. Holding 30 seconds for 3 times, and you can do it both sides. I always recommend doing both sides. 30 seconds, 3 times. You can also get into a bent knee and pull across to get a little more of a piriformis, a deeper glute muscle stretch. You can do that as well. The next thing that you're going to need is a lacrosse ball, and I like having these around because very easy to get into kind of some soft tissue mobilization or massage, and I like to find this big pocket of the outside thigh or quad area to roll or mobilize this ball all around to help loosen that up. The other thing that you can do is work that into the glute as well as another option, but it just depends on where your problem is with your bursitis. What's causing the issue? Identifying that is of primary importance. But these are 2 things to kind of work on or be aware of to help relieve that kind of bursitis pain that's very common and typical. Easy one, IT band stretch or glute med stretch with a strap and a lacrosse ball self-mobilization technique over the outside of the thigh. Do that for 2 to 5 minutes. Always do it both sides. Hope those help. I hope those 2 techniques help. One thing to always remember is that there's a lot of things that go on in diagnosing hip bursitis. It's not as clean as many people think. And so just because maybe these 2 things didn't quite help, or there's some others that helped you more, that's probably true, and it's all about getting the assessment and identifying what is most effective for you and your condition with hip bursitis. Have a great day.